Hello, everyone. I'm Josh Sharfstein. I'm co-chair of the Roundtable on Population Health Improvement and Vice Dean for Public Health Practice and Community Engagement at the Johns Hopkins Bloomberg School of Public Health. It's a pleasure to welcome you to the second day of our workshop called Population Health in Rural America in 2020. If you saw any of the sessions yesterday, you realize how fantastic a workshop this is. They're fascinating. If you didn't catch them all, they'll be recorded and available. But it really put a tremendous lens on the challenges facing healthcare and health in the rural United States with fantastic presentations from many different perspectives from all across the country. And today we are going to be building on that. Really, I think of yesterday as the building blocks of what is going on in different communities, in tribes, in hospitals, in community health settings, in rural areas. And now, today, it's about what can be done to improve population health. There will be two sessions of this workshop today. The first will discuss population health efforts and their sustainability. We'll be discussing community health needs assessments as a mechanism to incentivize collaboration between healthcare and public health and to accommodate community input to design activities and programs that are responsive to the needs in communities. As these programs mature, we'll hear about how other sectors within government and outside, like community development entities, businesses, and their philanthropic extensions, as well as non-governmental organizations, can become involved to support these collaborations and support their sustainability over time. Our last session in the afternoon will discuss a variety of policies that shape rural health and healthcare from the perspective of a hospital, and it will progress all the way up to the federal level. I think the opportunity here is to think about what can be done not only to sustain and stabilize rural healthcare, but to do it in a way that improves rural health. And I know my close friend and colleague, Karen Murphy, is going to steer a fantastic discussion in that second panel. It will also discuss rural tribal policy, the CARES Act, and rural-related health provisions, because this is a moment, as we heard yesterday, with the pandemic, of change and transformation in healthcare, including in rural areas, and of recognizing the deep disparities that exist in our country and thinking in different ways about what can be done about them. So I am looking forward to this first session, and I'm pleased to introduce the moderator, Alan Smart. He is a national spokesperson and advocate for improving rural philanthropy with his group called Philanthropy Works, but it is spelled philanthropy, W-O-R-X. The capital R, I'm told, is for rural. So he consults regularly with regional and national foundations on rural and philanthropic strategy, and recently completed a role as the project director for National Rural Philanthropy, partially supported by the Robert Wood Johnson Foundation, and based at Campbell University in Buies Creek, North Carolina. There is a full bio in your attendee packet, and can read more about Alan. Before I turn it over to him, I just wanted to particularly thank the team at the National Academies that has put together such a fantastic workshop. Carla Alvarado, Harika Dyer, Alina Bachu, and Rose Martinez, and others. It was a tremendous amount of work. I think I don't quite appreciate all the extra work that comes in to making a meeting like this work virtually, and really deeply appreciate the flexibility, skills, vision, and persistence that has made this meeting possible. So I really wanted to particularly thank them. And with that, I will turn it over to you, Alan. Good luck with the panel.